So we will begin. Please start recording and live streaming. Good morning. I'm Cheryl Neely. Welcome to the Foreign Press Center's video conference briefing with Dr. George Diaz on Remdesivir as a treatment for COVID-19. The meeting host will now mute all journalist microphones. Please keep your microphone muted until you are called on to ask a question. You may record the briefing by clicking on the record button on the menu at the bottom of the Zoom screen. The meeting host will now mute all journalist microphones, please. I'm going to unmute Dr. Diaz. Okay, we're hearing a lot of noise. Carlos, will you please mute the microphones? Okay, thank you. And we need to unmute Dr. Diaz again. Please pardon the interruption. Carlos, can you unmute Dr. Diaz? Okay, continuing on, if the Zoom session fails or disconnects, everyone please go back to the link and click on it to join again. If you have technical problems during the briefing, you can use the chat feature to chat with Bryce, my colleague, or the meeting host, and they will try to assist you. The ground rules for this briefing is that the briefing is on the record. Non-governmental guests invited to address FPC member journalists offer their views in a personal or organizational capacity and do not represent the official views of the Foreign Press Center or the U.S. government. So I'd like to introduce our briefer today, Dr. George Diaz. And first, Dr. Diaz, I'd really like to thank you for your time today, for being with us, and thank you as one of the very first responders in the U.S. For this pandemic. We really appreciate everything you do. Dr. Diaz is Section Chief of Infectious Diseases at Providence Regional Medical Center in Everett in the state of Washington. Dr. Diaz is currently investigating the use of Remdesivir in a clinical trial, and his experience using Remdesivir on U.S. patient 1 was published in the New England Journal of Medicine. Dr. Diaz is a leading expert on the treatment of COVID-19, and he will provide a brief overview of his experience treating the novel coronavirus and his partnership with the U.S. Centers for Disease Control and Prevention, which, as you all know, we call the CDC. His experience with working with them to treat the first confirmed U.S. patient. Then we will take questions and answers. And as you all know, the U.S. Food and Drug Administration just approved the use of Remdesivir to treat COVID-19 patients under emergency use regulations, while global clinical trials continue. At the end of the briefing, after we complete the English portion of the briefing, we will stay on those who want to participate in a Spanish language dialogue with Dr. Diaz. And with that, I will let the doctor give a brief opening statement, and then I will come back to open the question and answer session. Dr. Diaz.
Thank you. I'd like to thank the U.S. State Department and the collaboration with CDC that we've had throughout this entire time that we've had the pandemic in the U.S. Our story in Everett began on January 20th. At that point, we had the first confirmed patient with COVID-19 in our county. We immediately were contacted by the CDC, who recommended that we admit the patient for observation to our hospital. While he was admitted to the hospital, he initially had symptoms typical of COVID-19 with fever, cough, and generalized fatigue. He intermittently had diarrhea as well. A few days into his illness, the patient developed pneumonia. He developed shortness of breath, and he developed low oxygen levels when we checked his oxygen levels on pulse oximetry. Because of these findings, we suspected that he had progressed to pneumonia secondary to COVID. And at that point, with the CDC expertise on hand, they suggest that we consider the use of remdesivir. We had recently gotten reports out of China that a large number of patients progressed to severe pneumonia, as well as a need for care in the intensive care unit. Because of this, we reviewed this data from China with the patient, as well as the use of remdesivir. It had not yet been previously used in patients with COVID-19, however, had been tested in healthy volunteers during the Ebola outbreak. At that time, the drug appeared to be safe, but unfortunately was not very active against Ebola virus disease. So we could at least provide to the patient some safety data regarding the medication. In addition, there had been relatively recently released studies looking at the use of remdesivir in animal models, and it appeared to reduce the effect of the virus in the lung in these animals. For these reasons, the patient agreed to receive remdesivir. And Gilead, the manufacturer, and the FDA were able to provide it to us under compassionate use. Because of the proximity of Gilead to Seattle, we were able to receive the drug and begin infusing the medication within 24 hours. Before infusion, the patient had been having high-grade fevers and low oxygen levels, and we infused it that day. He did not have any symptoms from the infusion itself, and by the next day, the patient felt much better overall. His fevers significantly improved, and the patient stayed afebrile the rest of the time he was in the hospital. He did not have any ill effects from the antiviral, and he was able to come off oxygen within about 24 hours. Within about 5 days of the first dose, he was able to discharge to home, and he was sent home on home quarantine with under the care of the county health department. And since then, he's done quite well and has had no apparent sequelae from the infection after discharge. After the patient went home, we began seeing larger numbers of patients within our county and our area, which is Western Washington. And over the next few weeks, began adding patients to treatment through the compassionate use program with Gilead. And then after a few weeks in early March, Gilead was able to help us stand up a clinical trial here in our area at both Providence and Swedish Medical Center for treatment of patients with severe pneumonia. We have been treating patients who present with a pneumonia on X-ray, low oxygen levels, less than 94%, and a positive COVID test. We have enrolled quite a few patients since the volume of patients in our area has had significantly increased as we were one of the first epicenters of the pandemic in the U.S. On treatment with remdesivir, we have seen little in the way of substantial side effects from treating large numbers of patients. The primary symptom really is nausea occurring in less than 10% of patients. There are some exclusion criteria for use of the drug, and that's limited our ability to give some patients this medication. And the primary reason for not providing this medication has been due to abnormally low kidney function. Otherwise, we have primarily been using it in patients who have COVID pneumonia. After the first 400 patients were enrolled, the company added the option to use remdesivir in patients on the ventilator. Prior to that, we weren't able to enroll patients who were already on the ventilator when we received them for care. In the past week or so, there has been some data that's come out from the NIH on their trial, which has indicated that the recovery time for COVID-19 patients is reduced by roughly 4 days. they may also be seeing a mortality benefit, although that's not yet been published, and that they're undergoing further analysis of their patients to make that determination. In addition, the Gilead, the manufacturer of Remdesivir, also last week announced some top-line results from their pneumonia trial, which indicated that 5 days of therapy with Remdesivir pneumonia appears to be equivalent to 10 days of Remdesivir in pneumonia. They also added additional data as well in their press release that indicated that patients who received Remdesivir early, meaning during the first 10 days of symptoms, were more likely to discharge the hospital than those that were started after 10 days of symptoms had elapsed. The difference in the ability to discharge to the hospital was measured at 13%. Given these findings, the FDA has granted emergency use authorization for the use of Remdesivir in patients with severe pneumonia.
Great. Is that the end of your opening statement? Okay, thank you so much, Dr. Diaz. Dr. Diaz, we do have one request from a TV station that during the question and answer period, you look directly at the camera. It's better for them. Thank you very much.
Sure.
And so we will start the question and answer period. To ask a question, again, please click on the raise hand button at the bottom of the participant list. If you don't know where that is, open the participant tab in Zoom. The link is at the bottom. Click on participants and it will open a screen usually to the right. Click on the raise hand button and I will call on you one and one. Please make sure that your name and outlet show in the participant list. I will prioritize calling on those who have identified themselves. If you have called in by telephone, we will try to give an opportunity at the end to ask a question, but it's better if you use the link and log in on the website or the app. Okay, so with that, we will take, yes.
I'd like to add one more statement from my brief. So my hospital belongs to a large health system, Providence St. Health. We have 51 hospitals on the West Coast. The area that's been most rapidly hit by COVID-19. Since we had a number of hospitals participating in these clinical trials with Remdesivir, we've been conducting a retrospective review of our patients admitted to our hospitals with COVID-19. We have very preliminary results, but we also appear to be seeing a mortality benefit with Remdesivir use as compared to standard of care therapy. So those results are early but very promising, and we are awaiting a peer review before discussing further data.
Thank you. And for clarification, did you say mortality benefit?
Yes.
Could you define that for our journalists?
Yeah, so we appear to be seeing that patients that receive Remdesivir appear to have an improved or reduced mortality compared to those patients that do not receive Remdesivir.
Okay, thank you so much. Okay, I will begin now calling on journalists. And just to remind everyone, we'll have an English portion of the briefing that will last for a while, and then we will end the English portion and we will have an availability for those from Spanish language outlets to ask questions in Spanish. So if I will call first on Nikila Natarajan from the Indo-Asian News Service.
Yeah, thank you.
Thank you.
Thank you, Dr. Diaz. I'm Nikila from Indo-Asian News Service, and I also work with a think tank called Observer Research Foundation, both headquartered in India. I live and work in the US. Two things that you said stood out to me. You said that within the first 24 hours of Remdesivir, you noticed significant changes. I'd like you to hold that thought and tell me exactly what kind of changes you saw, which made you feel that this is a significant improvement, material improvement. The second point you said is about giving it early. Now, that's a theme we've been noticing across doctors' chatter, even on social media, about giving it early. and doing those randomized controlled trials. So I want you to just elaborate on both these pieces. 24 hours, what were those changes, and what does giving it early mean? At what point do you say this is early enough? Thank you.
Thank you. With respect to the findings in our patients that made us feel that he was improving, he had his fevers entirely resolved. So he no longer had fevers during the admission. Prior to treatment with remdesivir, he was having fevers as high as 103 degrees Fahrenheit, 39 degrees Celsius. Thereafter, his temperatures remained roughly 37 degrees Celsius. He was also able to come off of oxygen, so he no longer needed oxygen supplementation to maintain his saturations above 94%. In addition, he generally felt much better, like he was resolving the infection, and he no longer felt short of breath. Those were the three sort of features that we saw that made us feel that he was improving. With respect to early treatment, with the clinical trial that we've been involved in, the inclusion criteria is the presence of a pneumonia on X-ray, the positive COVID result, and also the finding of hypoxemia, meaning a saturation of 94% or less. And so those are the criteria that we use to enroll patients into the severe trial. In our institution and our health system, the majority of patients that would have qualified for the other trial, the moderate trial, for example, those patients that had saturations above 94%, the vast majority of those patients were able to go home. And preliminarily, very few of them appear to be returning to the hospital, and those are data that we're looking at to try to identify these people that don't have severe disease. Can they go home? With respect to remdesivir and severe pneumonia, at our institutions, we would, as rapidly as possible, when they met these inclusion criteria, we would start them on remdesivir, and ideally, the treatment would begin as soon as those criteria were met. And oftentimes those were within 10 days of symptom onset. And frequently they were usually around day 5 or so of symptom onset. After about day 10 of symptoms, we can see a dramatic worsening of symptoms with progressive respiratory failure and requirement for mechanical ventilation, for example. And so what the Gilead Severe study appeared to show is that patients that were started on treatment before that 10th day of symptoms, that cohort of patients had a higher likelihood of being able to be discharged to home, meaning, I think, partly clinical success.
Thank you so much.
Thank you. Okay, next we'll have Magda Sakowska from Polish TV. Magda, I'm trying to unmute you. There you are.
Okay, do you hear me? Okay, thank
Yes.
you. Good afternoon, thank you for doing this briefing. My name is Magda Sakowska, I'm a correspondent to Polish TV, Polsat News. Dr. Diaz, I have a question. Do you know, or could you tell us what kind of side effects remdesivir can cause? And in your opinion, what will be first, the cure for COVID-19 or vaccine?
I'm not sure that we, with therapeutics, can discuss a cure in 100% of patients. Dr. Tony Fauci of the NIH had indicated that remdesivir didn't appear to be a knockout 100% drug, but it did in his hands have effect, that it did have the ability to stop the virus, and they saw an improvement in recovery times. We have this therapeutic now here, and because the FDA has provided emergency use authorization, it will become available worldwide very shortly, and Gilead is working with local governments to provide this medication to those patients most in need. Vaccine work often takes over a year to determine its safety and effectiveness, and within the US there's many vaccine trials that are ongoing and enrolling patients already. We're hopeful that within a year we'll have a vaccine. In the interim period, it's important to find any therapies that we may have available for treatment of COVID, and remdesivir appears to be one that does have activity against the virus.
And what about the side effects?
Yeah, so the largest side effect that we've seen has been nausea. At my center, we did not have to discontinue that medication for that reason. Other side effects that one can see include transient rises in the liver function test of a patient. In our experience locally, those rises have been relatively mild and not have not needed discontinuation of the drug. We also know that COVID-19 by itself also can cause liver inflammation as well. And so it's a little unclear what the interplay between drug and the virus is in the liver. But inflammation of the liver can also be another side effect. But the issue that most commonly excludes patients from remdesivir has been abnormal renal function. And we have many patients who are elderly that present to the hospital dehydrated and have borderline renal function to receive the drug. And so there are quite a few patients where we've enrolled them and their kidney function has just barely been adequate for treatment with remdesivir. We've seen similar results in those patients that have received treatment. And generally speaking, we haven't seen substantial increases in abnormal renal function after starting treatment with remdesivir, even in those patients. But that would be another concern is in patients at risk for renal disease, they could potentially need to discontinue the medication due to renal issues.
Thank you very much.
Okay, next I'll call on, I'm afraid, please forgive me if I mispronounce your name. Is it Weier Gay from China Business Network? I'm trying to unmute you.
Can everyone hear me?
Okay, yes, now I can.
Thank you, doctor, for the briefing. My question is, so when we talk about that in early days when we give the patient remdesivir, it shows more improvement. But as far as I know, like in New York City, people are not admitted to hospital like some of my friends who got this COVID-19. They have fever, they have a cough, but most of the time they will not be admitted to the hospital. And we also have some other reports showing that in certain period of time, the situation, the condition will worse suddenly. So for those patients, I'm just curious about at what stage right now or in the future you're suggesting patients to getting remdesivir, and also because right now we have to get this prescription at a hospital because it's in a vial, it's not a tablet. So I would just ask your thoughts on this. Thank you.
Yeah, that's a really good question. What we have seen in our hospitals is that patients may present with mild symptoms initially, for example, no pneumonia and X-ray, and normal oxygen levels, but symptomatic. In the patients that are high risk, meaning those people that are age over 60 or have illnesses that places them at high risk for disease, those patients within our health system, we've been discharging them with pulse oximetry and telehealth monitoring. So we have telehealth nurses that will contact them by phone or by video to talk to them, to see how they're doing, to interview them, and also to measure their vital signs, including their oxygen saturations. The purpose of this is to try to detect any changes early before a patient becomes ill enough to warrant ICU level care. So we want to detect a change at the earliest stage of when someone develops what we would consider severe illness. A large majority of these patients who are discharged from the emergency department who have COVID end up having mild disease. And so what we want to know is in the patients that are in this category that don't qualify for admission and don't qualify for remdesivir, can we find the ones that are going to become sick and get them back into the hospital as quickly as possible? And so one way of keeping close track of our patients is to monitor them actively outside the hospital with oxygen levels and vital signs and history taking to safely bring them in as soon as we see a change in the condition that would warrant admission and potentially treatment with remdesivir.
Thank you.
Thank you. Okay, now I'm going to switch to a different region and call on, I believe it's Nia Fote from the News 2 Brazil.
Okay. Hello, good afternoon. Thank you,
Yes.
Dr. George Diaz. I speak a little Spanish too, but I speak Portuguese very well. So my question is, okay, for example, like there's this ongoing reopening phase of some states in the United States. And so, and the fear of the COVID-19, the resurgence of this COVID-19. So with your knowledge and this new treatment that you discovered, so do you think the mass use of this Remdesivir drug will give assurance to the Americans that, oh, we can go back to work and at least we have a treatment that can, I don't know, help us out with that?
Yeah, those are good questions. I would say that any medication that we use to treat an infection, whether it be to treat bacteria or viruses, we want to make sure that these medicines are used appropriately,
Okay.
because widespread inappropriate use of any medicine can result in resistance to that particular medication. And so as the FDA has approved this medication on emergency use authorization, it'll be really important that we try to use this medication as appropriately as possible. And at this point, it's only been shown to have some effectiveness in people that have severe pneumonia. So I would say that we need to be very careful in how we use this medication and use it very wisely, because widespread inappropriate use could result in potentially the development of resistance to the antiviral, as we've seen on occasion to, for example, treatments for influenza. Thankfully, it appears that we do have an agent in our armamentarium against COVID, but we have to use it very wisely. This should not be used as a crutch for patients to say, well, or people to say, I can now do whatever I want because we have a treatment. No, the people of the world need to continue to follow the guidance of the infection control and public health people that are advising them about social distancing, because that is the most effective treatment we have for COVID-19 at this point.
Okay, thank you very much.
Okay, now we'll go to a different region. We'll call on Jahan Zayib Ali from Pakistan with RE News.
Thank you so much.
Yes.
So thank you so much, sir. Thank you so much for arranging this briefing. So my question is it available in all over America? I mean, in all the hospitals, and is the clinical trials also going on? Thank you.
Yeah, so it's currently available in the U.S. under numerous sites that are part of the clinical trials. There's also availability through an expanded use program promoted by Gilead, so hospitals can apply to that program. And it's now available by emergency use authorization, which means that hospitals will now be able to order the antiviral through the normal processes of ordering any medication that they would otherwise bring into their pharmacy. So yes, it should be available to any hospital that requests it. Gilead is currently working on working with international governments also to make available to other countries that would want to have access to this medication as well. And I'm sure they're working on ramping up supply chain to meet the substantial demand that may be coming.
Thank you very much. We will now take one or two more questions in English, and then we'll switch to the Spanish virtual pool-asides. Next, we have Mladen Petkov from Bulgarian National Radio. And let's see, are you unmuted? Yes. Please go ahead, Mladen.
Can you hear me okay? Hello?
You sound very far away.
Okay, is this better?
Can you speak a little louder, maybe move closer to your microphone?
Yeah, thank you so much for doing this, Dr. Diaz. And you talked about the availability in the US, but I wanted to ask you if you can talk about the priorities, those areas that will have a priority. And also you mentioned about international cooperation and now currently Gilead working with local governments. Can you tell us more about this cooperation going on? Thank you.
I think the question had to do about international cooperation for access of Remdesivir to foreign governments. I can't say that I know the specifics of what that plan is. I would refer you to the Gilead Media Department. They can probably provide a statement as to what their plan is for distribution for worldwide use.
Thank you. We will try to find that media relations email address and send it out to those of you who RSVP'd. Let's see. Let's keep with. Let's go to Olivia Zhang with Kaishan Media, China. Okay, go ahead, Olivia.
Thank you. Thank you very much for doing this. My question is, I wonder whether you're paying attention to the clinical trial in China on Remdesivir, which has shown that there's no significant benefits to this the disease. And also wondering, you mentioned about the next steps. I'm not sure. You probably touch on that. I'm just wondering what's the next focus on this Remdesivir trial. If you can elaborate more on that.
Sure.
Thank you.
That's a really good question about the trial in China. There was a double-blinded controlled study in China that results were published in the Lancet about a week and a half ago. That study showed no benefit to Remdesivir. Unfortunately, the study could not complete enrollment of all the patients that were recommended. I think one of the ways that studies determine if there's a benefit is by making calculations to be able to detect a difference in a treatment or non-treatment. And so those numbers are very important to be able to find a statistical difference. The researchers in China were not able to complete the enrollment and only enrolled about half the number of patients that was recommended. The authors in that paper indicated that it could have been due to several factors. One, that the measures that were in place in the region where the study was being conducted were such that few patients after a certain date were being admitted to the hospital. And also those patients that were admitted later in the study when the numbers decreased entered the hospital very late and more sick. And so they expressed concern about their finding being valid because of those two factors. One, they weren't able to complete their enrollment, and two, the patients that they were admitting appeared to be sicker and had waited longer than that had been expected before the study started. With respect to next steps, we are currently awaiting the publication of the study from Gilead looking at 5 versus 10 days of therapy. Those results have not yet been published. We're awaiting the results of the NIH trial. Dr. Fauci had alluded to some beneficial effects in that study, and we're working on our study within our Providence St. Joseph Health System, which was also looking at mortality as an outcome, and we are ourselves waiting for a peer review before formally announcing the rest of the results of that study.
Can I just do a very quick follow-up?
Yes, quickly, please.
Yeah, I just wondering, is this trial just gonna be do like separately, and you're gonna pay attention to the research results from other countries, or there is actually gonna be actual cooperation on those trials with China and probably other countries too?
Yeah. So the Gilead Severe study was a multinational study involving countries from all over Asia, Europe, and the United States. And so that study has been actively enrolling patients worldwide, and I would anticipate that further studies will still continue to be multinational.
Okay, we'll take one final question for the English portion of our briefing. I will call on, we have a reporter from Poland again, Marcin Rona with TVN Polish TV.
Thank you. Dr. Remdesivir seems to be the first step. Do you see it as a path to a more effective cure, or this is as much as we can get with Remdesivir and we need to look for something else more effective if we really want to have, a miracle drug that would cure it 100%. Thank you.
My personal opinion is that remdesivir has activity against the virus, and that there are benefits to using the medicine that improve the lives of patients who receive it. There are patients where we know that present with severe disease or later disease, where they are on a ventilator, very ill, and a large number of these patients will expire. Part of that disease process is something called cytokine release syndrome, where the virus triggers an immune response in the body that causes severe and rapid decompensation, which is a process that is mediated by specific hormones in the body. There are ongoing studies now with other therapeutics to try to reduce that inflammatory cascade in the body. These are a class of antibodies that target specific cytokines called IL-6. These trials are currently ongoing in the US, and it may be that in the future, in some of these very, very ill patients, there may be an additive effect of using therapeutics like that. There are a number of other studies that are being looked at as well for this disease, including convalescent plasma and other therapies that are also experimental. They're not quite as far along at this point as remdesivir is. Thankfully, it appears that we have at least one therapeutic at this point that we appear to know has benefit. And so there's going to be further data from remdesivir coming out. And over the next few months, we will likely have further data on alternate therapeutics as well.
Thank you.
Okay, thank you very much. I want to ask Master Control and our tech people to continue the live stream and continue the recording. That concludes the official part of the briefing in English. If anyone did not get to ask a question, you may email any remaining questions to dcfpc@state.gov, and we will forward those to Dr. Diaz. For those who would like to join the Spanish language, we're calling them virtual pull-asides. Please stay after the others leave the meeting. All others may leave the meeting to disconnect. A transcript of the official briefing in English will hopefully be ready this afternoon or tomorrow morning, and the video and transcript will be posted on the Foreign Press Center website as usual. We will not have a transcript of the Spanish portion, but we will post the video on our website. So if I could, we have a number of people who have requested to ask questions. Y vamos a empezar ahora con Beatriz Pascual de EFE España. Oh, I accidentally muted you. Okay, go ahead, Beatriz.
De acuerdo. Hola, gracias. Quería preguntarle, doctor, la FDA, the Food and Drug Administration, ha autorizado el uso de este medicamento también en niños. ¿Han observado algún tipo de diferencia en el tratamiento de niños? Si en su ensayo clínico también han tratado niños, si nos puede explicar un poco eso. Gracias.
No, hasta ahora no hemos tratado este medicamento en niños. Para el estudio que hicimos nosotros, el paciente tenía que tener 18 años o más. Entonces, para nosotros no hemos tenido pacientes que hemos usado este medicamento en jóvenes o niños.
Ok. Ya. Ok, vamos a seguir con Gustavo Alegre de NTN 24, yo creo de Colombia, ¿verdad?
Bueno, Canal Internacional de Noticias.
Okay.
Y estamos en Estados Unidos. Doctor, muchas gracias por atendernos. Un gusto escucharle y aprender. Quería preguntarle por si ha tenido una experiencia particular con la comunidad latina. Algunos estados han recogido información desagregada que muestra que los latinos, junto con los afroamericanos, son las comunidades que han sido más afectadas por la COVID-19. Quería saber si ha tenido una experiencia particular con el uso del Remdesivir con los latinos particularmente y si tiene algún comentario en el trato con la comunidad latina, que los expertos, y usted nos lo puede confirmar, coinciden en destacar que no se trata de una cuestión del origen de las personas, sino por el tipo de trabajo que hacen. Gracias.
Sí, en mi estado hemos visto esto también, que gente de origen latina ha tenido más casos de COVID-19 que la población en general. En estos pacientes no estamos seguros todavía por qué ellos en números más grandes han tenido que ser internados en hospital y también han muerto, pero en el estudio que estamos haciendo nosotros en Providence hemos visto que casi un número grande de nuestros pacientes son de gente latina y se espera que sea por razones de cómo viven, que muchos de ellos viven en casas con gente de hijos, niños, quizás abuelos, y el virus que es posible que se contagie más fácil en una comunidad así, que está donde diferentes generaciones de personas viven en la misma casa. Y también es posible que el tipo de trabajo y por recursos bajos, estas personas no han podido mantener o observar la distancia social por razones económicas. Y yo creo que esas cosas económicas son unas razones más grandes que el origen de la persona de ser más afectado con este virus.
Ok, gracias. Y seguimos ahora con Alejandra Arredondo de Voice of America. Oh, ok.
¿Me oyes? ¿Me oyen? Hola.
Sí, escuchamos.
Muchas gracias por hacer esta conferencia. Mi pregunta es, ¿qué tanto depende la efectividad de este medicamento de que haya una gran cantidad de pruebas en la población? Porque usted antes había dicho que las personas es más efectivo cuando se usa al principio del contagio, ¿no? Entonces, ¿depende mucho o poco la efectividad del medicamento de que haya gran parte de prueba en la población? Muchas gracias.
Es una buena pregunta, porque al comienzo del brote aquí en Estados Unidos, nosotros también tenemos dificultad en obtener los exámenes en una forma rápida para tener los resultados de las muestras. Y esto creo que al comienzo lo hizo un poco más difícil para nosotros empezar a poner pacientes en el estudio clínico, porque si tomaba 3 o 4 días para recibir los resultados, no podíamos administrar Remdesivir. Y en esos casos yo creo que empezarlo un poco más tarde quizás tuvo un efecto. Por eso yo creo que es muy importante, es bien importante saber qué tipo de infección tiene una persona, porque en estos casos se debe requerir que una persona que pensamos que tenga COVID, podamos hacer la muestra en una forma rápida para tener el diagnóstico y para empezar el tratamiento preparado lo más rápido que se pueda. Por eso es muy importante para que países tengan acceso a las muestras para poder determinar qué pacientes tienen COVID y cuáles no. Porque no todos los pacientes que vienen con esos síntomas tienen COVID. Algunas personas pueden tener un diferente virus o una neumonía bacterial o algo diferente. Y queremos usar este recurso de este medicamento de una forma apropiada en pacientes que sabemos que tienen COVID y que tienen neumonía. Por eso es muy, muy importante tener acceso a las muestras para hacerlo.
Ok, gracias. Seguimos con Pablo Guimón del país, de El País, España. Ok. I think I'm muting and people are unmuting. Okay.
¿Ahora me oyen?
Sí, siga.
Bueno, muchísimas gracias, doctor, por esta oportunidad. Y quería preguntarle una pregunta un poco general. Ha dicho que han notado algún cambio también en la mortandad, ¿no? Que se reduce un poco. Quería saber si nos podían explicar un poco más eso y también en qué medida, porque bueno, en lo que han visto hasta ahora es en pacientes, por lo menos en el primer caso, muy jóvenes o bastante jóvenes, administrando el fármaco muy pronto, que se conseguía una reducción de 4 días, digamos, en el tiempo en el alta de la hospitalización. ¿Y eso qué puede significar para la red bueno, o sea, qué mejora sustancial puede significar, ¿no? O sea, ¿cuál es esa mejora que veríamos? Y por último, quería preguntarle simplemente si nos puede aclarar si tiene usted alguna relación contractual con Gilead o alguna...
Sí, claro. Yo soy un investigador con Gilead. Mis hospitales de Providence, tenemos 14 hospitales que hemos participado en este estudio de este medicamento. Al respecto de la mortalidad, el estudio del NIH que el doctor Tony Fauci y esperamos, ojalá, mandarlo para publicación pronto. Al respecto a tratamiento ahora, lo que sabemos es de que en los estudios que han salido hasta ahora, que pacientes que reciben el medicamento hasta ahora tienen un tiempo para recuperarse más rápido si reciben el medicamento, y digamos que una persona quizás que estuviera en el hospital a 15 días, si recibe el medicamento, eso se reduce a 11 días. Y también en los pacientes que reciben el medicamento temprano, o sea, antes de terminar 10 días de síntomas, el 62% de ellos pueden volver a casa, comparado al 49% de pacientes que se recuperan y vuelven a casa si empiezan el medicamento después de 10 días de síntomas. Lo que aprendemos de esto es de que es muy posible que el tratamiento temprano, cuando una persona desarrolla neumonía, es el tiempo optimal para dar este medicamento.
Okay, muchas gracias. Vamos con Cristina Olea, próximamente con TVE, Televisión de España. Cristina, ¿escucha?
Hola, ¿me escuchan ya?
Sí.
Sí. Vale, pues me gustaría, muchísimas gracias, doctor, me gustaría pedirle que nos repitiera algunas cosas que ya ha contado usted en inglés, pero me gustaría que las volviera a contar en español, si es posible. Para empezar, me gustaría, como médico, que nos relatara qué observó en esos primeros pacientes con COVID-19 y qué cambios observó directamente en ellos al administrarles este fármaco. Y también me gustaría si nos pudiera decir, como médico, qué impresión tiene sobre cuándo podría haber una vacuna disponible y qué les aconsejaría, mientras no la hay, a los estadounidenses, ahora que están volviendo a trabajar y en muchos sitios están reabriendo negocios, qué les aconsejaría que hicieran.
Gracias. Sobre la primera pregunta, que fue sobre mis observaciones con los primeros pacientes que recibieron Remdesivir, es difícil saber exactamente por cada paciente cuál es el resultado, ¿no? Porque se requiere un estudio clínico para saber con certidumbre cuál es el efecto. Pero lo que puedo decir es de que los pacientes que hemos dado este medicamento en mi hospital, no hemos visto muchos efectos malos de este medicamento. Casi nunca hemos tenido que parar el medicamento por cualquier razón de náusea o de efectos al hígado o riñones. La mayor parte, digamos, más del 95% de pacientes no han tenido que parar el medicamento por cualquier razón. Al respecto al medicamento, como se relaciona a la vacuna, esperamos que la vacuna salga, pero normalmente se demora más o menos un año para poder evaluar una vacuna, para asegurarnos que es una vacuna que no tiene peligro y también que sea efectivo. Durante este tiempo de los estudios de vacuna, la única forma que tenemos para tratar esta infección es a través de un medicamento, una medicina. Y en esta época ahora parece que este medicamento tiene alguna efectividad contra el virus. Por ahora, hay muchos países o estados en Estados Unidos que están empezando a abrir sus economías. Eso se tiene que hacer a través del gobierno del estado, con el gobernador y con el Consejo de Salud Pública. Porque en mi estado, por ejemplo, en el área donde está Seattle, esta comunidad solamente tiene el 2% de anticuerpos positivos en la población, lo cual me dice de que hemos tenido bastantes pacientes en el hospital en mi área, pero solamente hasta ahora el 2% ha tenido la infección. Y eso nos preocupa bastante por un segundo brote si la economía se abre muy rápido.
Muchas gracias.
Ok, vamos a otra región otra vez con Alina Diaz de AFP Francia.
Sí.
Yes.
Buenas tardes. Muchas
Buenas.
gracias. Muchas gracias por esta oportunidad. Me gustaría preguntarle al doctor, primero que nada, si esta es una medicación, un medicamento caro. Yo sé que por lo que usted explicó, están haciendo los acuerdos para una distribución internacional, pero me gustaría saber si de base es un medicamento caro que pueda hacer pensar que va a ser difícil que todo el mundo acceda. Y la siguiente pregunta es, usted como doctor que ha tratado el primer paciente infectado con este virus en Estados Unidos, ¿qué es lo que más le preocupa viendo el grado de mortalidad que ha tenido esta enfermedad? ¿Cuál es su mayor preocupación como médico?
Primeramente, el costo, yo no sé, eso lo dirigía a la compañía Gilead. Ellos quizás pueden dar un estimado de cuánto va a costar el medicamento. Ese número yo no sé. Lo que me preocupa a mí es de que ahora este virus ha tenido un efecto muy grande sobre las economías del mundo y es difícil mantener la distancia social. Y lo que me preocupa a mí es de que cuando la economía se empieza a abrir de nuevo, vamos a ver un segundo brote que sea quizás hasta tan grande como el primero. Y el primero fue muy difícil para nosotros y para todo el mundo. Y eso más que nada me preocupa, que no sé si vamos a tener los recursos para poder manejar un segundo brote o segunda fase de esta infección.
Ok, y tenemos uno o dos más. Bricio Segovia de Voice of America Televisión.
Sí, hola, gracias por esta oportunidad.
Hola, Bricio.
Hola, Cheryl, qué bueno verte. Una pregunta sobre cuánto tiempo se prevé que tarde esta fase de uso de emergencia y podamos pasar a una fase más generalizada del medicamento. Dicho de otra manera, ¿cuánto puede extenderse esta fase y cuándo podríamos tener un medicamento aprobado para tratar el COVID-19, al menos teniendo en cuenta los tiempos habituales con este tipo de ensayos clínicos? Y una segunda pregunta sería si me pudiera resumir los efectos secundarios que han observado hasta el momento. Gracias.
El tiempo desde ahora hasta que el FDA apruebe el medicamento es un poco desconocido, pero el FDA ha dado esta autorización de emergencia por los datos que salieron de 2 estudios que todavía no han sido publicados en un jornal médico. Espero que después de más análisis, especialmente a relación de mortalidad, si eso sale que definitivamente hay un beneficio en mortalidad, que la FDA pueda autorizar ese medicamento para uso general. Lamentablemente esperábamos mucho del estudio de China, porque era un estudio donde se usaba el placebo también, y esperábamos tener esos datos para decir más definitivamente que este medicamento es efectivo. En esa área no pudieron completar el número de pacientes que tenían que tener el estudio para poder detectar la diferencia. Y ahora los estudios que han seguido, no se va a hacer posible usar placebo, porque sabemos que hay un nivel de actividad o efectividad con este medicamento hasta ahora, y los estudios que normalmente se hacen para establecer que un medicamento es efectivo usando placebo, no creo que se van a poder hacer de nuevo. Entonces lo que va a pasar es vamos a tener más estudios o más datos científicos que van a ser estudios que nos digan quizás que hay un beneficio a mortalidad, pero no van a ser estudios perfectos como queríamos que sean con un brazo de placebo. Y no me acuerdo la segunda pregunta, disculpa.
La segunda pregunta era sobre los efectos secundarios del medicamento. Muchas gracias.
Menos mal, en nuestras manos no hemos visto muchos efectos secundarios. El más grande es náusea. Eso normalmente se puede manejar con otros medicamentos de antináusea. también se puede ver cambios en los riñones y exámenes de hígado. Pero para nosotros no hemos tenido que parar el medicamento por esa razón. Aunque hay gente de edad avanzada que quizás vienen con los riñones que no están completamente normal y con líquido por suero se pueden mejorar si están deshidratados. Pero de todas maneras, por su edad, sus riñones están apenas al nivel para poder empezar este medicamento. Y en pocos casos hemos tenido que parar el medicamento porque ha habido un efecto pequeño, pero suficiente para tener que parar el medicamento por razones de riñones. Pero casi siempre es una persona anciana.
Gracias. Ok, tenemos también Víctor Sancho desde México y vamos a ver si él tiene una pregunta. Quería preguntar, pero no levantó su mano. Víctor. ¿Víctor? Ok, él no contesta. ¿Víctor? Ok, no. Ok, muchas gracias. Esto concluye entonces el briefing de hoy, los virtual pull-asides. So thank you all for participating. Gustavo?
I'm sorry, Cheryl. I'm sorry. I just came back to see whether Dr. Diaz have a couple more minutes for the China clinical trial question.
Actually, we had a request for a one-on-one that he has agreed to do with NTN.
Okay.
24. Gustavo, if you're still there. And I'd like to ask all others to leave the room. And is that Olivia?
Yeah, or maybe.
Okay, if you want to send us the question, we'll forward it to him.
Yeah, sounds good. Thank you.
Okay.
So much.
Thank you.
Mm-hmm.
Okay, Gustavo, I'm going to unmute you.
Hi, Doctor. I was wondering if we can call you from our studio to record a 5-minute interview.
I would defer that to Mark Gross, our National Communications Director. He's managing that work.
OMG.
He said that there's a few minutes, so let me just, he's unmuted and he can tell you how to contact them.
Yeah, if you can hear me, I'm fine with that. Can you hear me okay, Cheryl?
Can you speak up a little?
Yeah, Mark, how you doing? I'm a reporter. I work for the international news channel NTN 24. We broadcast our signal through the US and the Americas. And I was interested in having a short interview in Spanish to trying to summarize what we have talked in this conference call through the doctor in Spanish to be aired tonight. If possible, we can record the interview in the next 5-10 minutes, if possible.
Yeah, I'll email you my email address, or I'll chat you my email address, and we can set it up.
Okay. Just one question. Do you think it could be today? Because we are planning our show tomorrow for tonight, and I was wondering if we can count on this interview or not.
Yes, we can do that today.
Oh.
I think if he's going to send you a chat via Zoom, Gustavo.
Okay.
With his email address. Mark, you can send that privately. You can select which journalist, or you can send it to everybody.
Yeah.
Actually, don't send it to everybody because it'll go up on the live stream.
I already have the email.
Okay. Okay.
I already have the email.
Okay, so that concludes our activities for today.
Thank you very much. That was very useful.
Thank you. We'd like to thank you again, Dr. Diaz, for your time. This was wonderful. Mark, thank you so much for setting this up. And to all of the journalists who joined, muchas gracias. Y hasta luego.
Gracias.
Thank you so much. We'll leave the meeting now.